Good day, sir. So today we are going to present our topic on the most common sports injuries in netball. So with me are Komalpreet Kaur, Nurul Hadira, Priyadarshini, Srinder Kaur, and myself, Siti Batrisha. Okay, so for what we're going to discuss in this presentation is, first of all, the introduction of netball, and secondly, the injuries that often occur in netball, followed by the signs and symptoms, the treatments, and the prevention.
I will present about the history of netball. The history of netball can be traced to early development of basketball. A year after basketball was invented in 1891. The sport was modified for women to accommodate social convention regarding their participation in sport, giving rise to women's basketball. Domestic netball competitions arose in several countries during the first half of the 20th century. By 1960, the rules of the netballs were standardized internationally. Today, netball is popular in Commonwealth nations and is reportedly played by over 20 million people worldwide.
Alright, so there are seven types of players and positions in netball. The first one is center C, known as C position. This is where the game starts and is allowed anywhere on the court except own and opposing team's goal circles. Next, we have the wing attack position known as WA. This position is responsible for gathering the ball. Next is goal attack position known as GA position. This position safely gathers the ball and pass to the shooter or take a shot. The next one is goal shooter known as GS position. This position is where it creates space so teammates can pass the ball. Wing defense known as WD position. This position is responsible for closing down opposing players and defend the goal circle. Last but not least, we have the goal defense known as GD position. This is where the position keeps the opposing team from passing the ball. And lastly is the goalkeeper known as GK position. This position is responsible for closing down opposing shooters and prevent ball from reaching the net.
Okay, good day. So my name is Hadira. So now we move on to the rules and regulations. So as we know, playing netball involves two teams that will be compete between each other. So the size of the netball court must be 30.5 meters long and 15.25 meters wide, as we can see in the first figure here. So it must be divided into three sections, which two sections will be goal third and the middle one will be named as center third. So for each player, they must be alert with their own position, because if they cross another section that they are not supposed to, they will be deemed offside. So the duration of the game would be 15 minutes for every 4 quarters, and players that holding the ball must not hold the ball for more than 3 seconds and must not take more than 1.5 steps when holding the ball. So the players must take at least 3 feet away from individual that owns the ball to avoid any contact, and the ball must go through the ring hoop to mark as one goal, and the team that has the highest score of goal will be announced as the winner. So next.
Okay, moving on to the physical activities involved in netball. So netball requires the players to perform high-intensity physical activities such as sprinting, changing directions, and jumping. Additionally, there are also physical activities that do not require much energy, such as walking, passing, and standing.
Okay, and then lastly, for the Malaysia recognition of netball. So netball events were conducted in 113 districts in the year 1998, and there were around more than 1,700 netball teams that were registered in Malaysia that year. And it was featured in the 21st Southeast Asian Games in Kuala Lumpur, and Malaysia had also participated in the 7th Asian Youth Netball Championship, which was organized in India. And additionally, netball is usually being played in schools by students. Okay, next.
Okay, so moving on to the common injuries of netball. Okay, so we have ankle sprain, Patellofemoral Syndrome, Patellar Tendonitis, Shin Splints, and ACL. Okay, ankle sprain.
Okay, so firstly, we will begin with ankle sprains. So ankle sprain is one of the most common injury that happens during to a netball player. This is due to the number of leaping, running, and changing of direction during the gameplay and during the training sessions. So how this thing happen? How ankle sprain happen is when the ligament on the side of the ankle might stretch or tear if there is a rapid twist or roll to the ankle, as can be seen in the picture where the ankle is being twisted. And then a sharp inward and downward movement of the foot strains the tendons around the outside of the ankle, and which will result in an ankle sprain. Okay, next. So one of the signs and symptoms that will lead you to know that you have an ankle sprain is when your ankle starts to swell, and you will have some kind of pain and bruising, like the blue black marks around your ankle, and weight bearing difficulties. Okay, next. So for the treatment or how you can cure an ankle sprain is by following the police principle, which is the protect, optimal load, ice, compress, and elevate. So for resting, it requires resting the wounded region at the first and gradually introducing mild movements after a few days. So you can start moving your ankles slowly as the day passes, and then you can do elevation while laying down. You can place your damaged ankle on a stack of cushion to assist elevate the region. And then icing can be done every 10 minutes for every 1 hour as a general guideline to cure your ankle sprain. And then lastly, taping can be done after the first ankle sprain if your physiotherapist can recommend it. Okay, next. As for the prevention for the ankle sprain to not happen in the future, the player can have preventative taping done around their ankle before they go to the field, and they can do special fitness training, and they can also do an evaluation on their shoes so that they can buy the proper shoe that can be played on field. Okay, next.
Okay, next will be named as Patellofemoral Syndrome. So this is a type of chronic injury because there is an overuse of the knee joint and also cause patellar trauma. So what happens is when we are bending our knee, our patella will actually rubs up and down along the groove in front of our shin bone. As we can see in the first figure here, the bluish and grayish here. So when there is overuse of knee joint, the patella will actually rubs out of alignment, which it will rub on the femur bone underneath. So we can see in the second figure here. So because of this, it will cause irritation and cause pain around our knee. So because playing netball involves a lot of jumping, a lot of quick turning motion, and also running, it may result in overuse and abnormalities of the patellofemoral joint and lead to the patellofemoral syndrome. So next. Okay, how do we know that this player have suffered from patellofemoral syndrome is cause swelling, especially after exercises, and the victim will having a very hard time going down the stairs or sitting for a very long period of time, and aching pain in her or his knee joint, especially under the patella. And one of the major symptoms is clicking or cracking wound around their knee, especially when they are bending. And the vastus medialis oblique, which is one of the 4 quadriceps muscle in our knee, will actually reduce in size. So next, okay, some of the treatment that we can use to treat this syndrome is, of course, the RISE principle, which is suitable for immediate treatment, and exercise therapy, which exercise depends on what is the cause of the patellar pain, such as squat exercise, hamstring stretch. So these kind of exercises will help in long-term recovery and reduce the knee pain. Okay, next. Okay, some of the treatment would be patellar taping, where the tape will actually pull away the kneecap from the pain area, and there is also a knee brace. So we can see there is a hole in the middle of the knee brace. So it's actually to support the patellar joint, and there is also a sports massage which help to lose the tight stretches. If the pain got worse, a surgery must be conducted. So next, some of the prevention to avoid having this patellofemoral syndrome is ensuring a healthy weight, because our knee is actually support our body weight, and choosing the right shoes to wear so the stress and the pain that occurs around our feet will not be shifted away to the knee. And it is very necessary to have a warm up and stretching before the game. Next. Okay, some of the exercises that the bowlers can do is glute bridge and also plyometry exercises, which involve depth jumps and also split squat jumps. So these kind of exercises will increase strength of the glutes and hips and strengthening hamstring flexibility. Okay.
Okay, so the next injury is called patellar tendonitis or jumper's knee. So it is a serious condition that occurs due to the inflammation of the patellar tendon located at the kneecap. So the patellar tendon becomes inflamed due to overuse of excessive force or basically strength. The tendon which connects the patella or the kneecap to to the tibia becomes inflamed. So this will weaken the tendon, cause pain, disrupt movements, and will create tears in the tendon if it is left untreated. All right. So for the signs and symptoms of patellar tendonitis, so first is tenderness around the kneecap area. The kneecap hurts when any kind of movement is involved, even like minute movements. The site of the injury will still hurt. There will be also swelling around the kneecap and pain behind the lower part of the kneecap. And so there are varying signs and symptoms for each player when it comes to patellar tendonitis. So for a more concrete sign of patellar tendonitis, an X-ray could be done to assess the condition of the kneecap and the tibia. Okay, next for the treatments. So patellar tendonitis requires a lot of care during the recovery stage, as it may not even fully heal after months of rest. So just like the previous injuries, you can also apply the RICE procedure, so resting the knee and applying ice, which is a simpler, more immediate treatment for the injured person. And next is also kinesiotaping. So kinesiotaping around the knee allows the blood and the lymphatic fluid to travel to the site of the inflammation and heal the injury from inside out. And the other types of treatments are medical procedures. So medical procedures for jumper's knee is very new, and so there are not a lot of like research that backs it up, but there are some positive side effects from these treatments. So the first type of like actual medical treatments are injections. So there are corticosteroid injections, which is when the sheath surrounding the patellar tendon is injected with a drug called corticosteroid. So this is known for pain relief, but it also has negative side effects as it causes the tendons to further deteriorate. And the second type of injection is called the platelet-rich plasma. So this type of injection promotes the growth of new tissues and thus fixes the patellar tendon. And the last one is a surgical debridement. So in this case, the surgeon will make incisions on the knee, and the damaged tissue from the patella would have the tendon that connects the patella to the tibia will have to be removed, and then they would leave out the good tissue to recover on its own. And for the prevention, just like the previous injuries, they can wear knee support to prevent the injury from happening in the first place or after recovery. Athletes should wear knee support during any strenuous physical activity. The next is strengthening exercises. So they should do strengthening exercises to build more endurance and strengthen the muscles in the legs so that the muscles will be able to absorb some of the impact of any kind of use. And the last one is to make use of soft surfaces. So athletes who had jumper's knee or want to prevent from jumper's knee need to use specialized sports shoes with cushioned insoles, and also avoid doing any high impact physical activities such as running or jumping on hard surfaces. So soft surfaces such as sand is a good alternative. Okay, next.
Okay, next we have Shin Splints. This can be a chronic and acute injury. It is chronic if it's not treated in the long run. Muscle and bone tissue known as preosteum in the leg become overworked and by repetitive activity. So shin splints usually occur by pushing and straining of the muscles and connective tissues of the lower leg. As we are all aware that playing netball involves jumping, running, and many other movements. So this will cause the shin bone to become inflamed, swollen or irritated, and weaker as a result of repeated repetitive pressure from running and jumping. Next. Right, so now we have the signs and symptoms of shin splint. The first sign is usually a dull ache around the shin bone area. Next, the victim may suffer from pain that develops during the exercise, pain on the either side of the shin bone, or tenderness or soreness along the inner part of the lower leg, and also pain along the inner part of the lower leg. Next. Okay, now we have the treatment of shin splint. The first one is usually RICE. RICE principles would be suitable for immediate treatment. Next, there would be a take an over-the-counter pain reliever to reduce some pain, and surgery in rare cases would be recommended if the pain lasts more than several months. Next is wearing elastic compression bandages around the shin bone area may also treat shin splints. Next, we have foam roller. Use foam roller to massage your shins if the victim is suffering from shin splints. Okay, next. Okay, so there are a few ways to prevent shin splints, by which the first one is to always stretch your hamstrings and calves. By stretching your hamstrings and calves, you will basically be able to tighten your muscles in the leg, and you won't have the chance of getting the shin splints again. And the second one is to exercise on softer surfaces such as mud or fields. This is because you wouldn't be able to have any injuries if you are exercising on soft surfaces rather than on the hard surfaces like rocks, stones, and etc. So the last one is to always do not increase your physical activity suddenly, as it could overstretch your muscles, in which this will increase you to get the shin splints frequently. So it's always important to have exercise in moderate and slow by slow. Yeah.
I'll present about the ACL, which is anterior cruciate ligament. ACL injury is a tear or sprain of the anterior cruciate ligament, which is ACL. It is one of the strongest type of bone. Actually, ACL injuries most commonly occur during sports that involve sudden stops or changes in direction, jumping, landing, such as soccer, basketball, football, and downhill skiing. The signs and symptoms of ACL are swelling, hearing of pop sound in the knees, feeling painful to bear the weight. Treatment for ACL is actually the RICE treatment, which is also involved in other injuries as well. So first one is rest. Rest is to reduce knee pain, which helps in long-term recovery. And then ice. Ice helps to actually relax the tight structures and muscles around the painful area. And compression, which is the kneecap, would be pulled away from the pain area. And elevation, if we elevate the leg, means the inflammation around the patella would also reduce, and also the surgery. So if the condition got worse, surgery must be conducted to operate in releasing the tight lateral. How to prevent ACL? First of all, we have to implement targeted strength training. Strength training includes high intensity jumping exercises that strengthen the quadriceps and hamstrings of the thigh, and then focus on balance. The stress and pain that occurs around the feet would not shifted away to the knee, and also do warming up and stretching before the game. It helps to reduce stress and strengthen the muscle around the individual knees. Thank you.
So for the conclusion, we realized the important for future teachers to acknowledge the common type of injuries, especially in netball, because we know that netball is one of the famous game that have been conducted in many schools. And by this assignment, we have gained knowledge on the background of the netball, where we understand the type of injuries, the prevention, also the treatment, and the responsibilities of taking care of the students would be our priorities. So that's all from us. Thank you.
Thank you.
Thank you.